Hi, I'm Phil.
Hi, I'm Esther.
So today we're going to do a video on toenails. So when they're damaged, deformed or curly like this. So we'll often have patients come in and they show us their toenails and they're really ashamed or they're concerned that we've never seen, something like this before. I guarantee you we've seen something like that already that day. We know that's what we do. We look after people with severe sort of foot problems. So this here is a great example of a nail that is, we call that involuting. So the nail is sort of curling and curving. So that's an example that we thought we'd use today. So the first question is, what makes a toenail go like this? So Esther, what's one reason that this might happen?
I'm thinking could possibly be genetics involved with a nail looking like that. Could also be the way that you may be cutting your nail.
Definitely.
Incorrect.
Yeah, even just a one-off cutting it incorrectly can start to make the nail, curl or bend or ingrow. Yeah.
Footwear as well, like you do
Tight
wearing
shoes.
tight shoes.
Yeah.
So it could really have an effect on the way that there's pressure on the nail and on your feet, so on your toes.
For sure.
Yeah.
And that pressure causes damage as well. You can see this nail here is getting quite thick as well. So damage to the nail, like repetitive stress, can cause it. From a shoe or a one-off incident. So the usual one is the horse stood on it or the shopping trolley ran over it.
Yeah.
They're the two. Stay away from horses and shopping trolleys. There's another cause that can sometimes make the nails go curly too, and that is when a fungal infection gets in the nail. So when that happens, it thickens the nail and then that nail deforms and does the wrong thing. So there are lots of things that can go wrong. There are other systemic conditions too. Things like psoriasis and other skin conditions can affect the nails as well, but it's a bit less common.
Yeah.
So I reckon that's a good example of why this happens. But if it's happened, what do we do? What are the sort of treatment options? So what would you say would be your first approach with a nail like this, Esther?
So my first approach will probably be conservative treatment. So I'll reduce that the thickness of the nail with a burr or a nail filer. I'll also cut the corner of this out. That's probably causing the pain.
Because they can be quite sore, can't they?
Yeah, they can be. It looks pretty.
Do you recommend doing that at home?
No,
No? So
do that at home.
not in the bathroom?
No.
No? Why? What could go wrong?
Because you could basically hurt yourself. You could cut into your skin and probably possibly cause an infection, which you don't want.
Not fun at all. No.
So I'll probably recommend for you guys to come and see us, the foot experts.
That's us.
Yes. To get this done. Yeah.
So if someone has pain, the nail looks like that, doing what you just said can often relieve the pain. If someone's in pain, it can really relieve the pain. Do people sometimes need recurring? Like, did you have to do it once, or does it sometimes have to be done a few times?
Yeah.
Do you find?
It's sometimes if it's genetic related and if it's an ongoing problem for years and years, then it's likely going to come back like that, and so or probably a treatment option for that will most likely be something like nail surgery.
Nail surgery, yeah, for sure.
So, but probably another more conservative approach would be nail bracing as well. So,
nail bracing, yeah. So that's something not many people know about that we can do. Just like you get braces to straighten your teeth up, we can actually do nail bracing to straighten nails when they curl. So basically it's a way of pulling that involuted or curled nail back into position. So there's various products we use for that, but they're either a UV cured resin that we put on the nail that straightens it out, or we glue these little thermoplastic ones as well. So they're not intrusive, so you can still wear your shoes, they don't hurt at all. But any of these treatments take time, just like having braces for your teeth. It's not something you just do and it's fixed. It takes a bit of time, but it's not nearly as expensive as your orthodontic braces.
Yeah.
Good news.
That is good news.
Any people out there wondering, it's very minimal cost, but big improvement.
Yeah.
So, and I'm thinking of a person I did that for recently, a lady who in her family has a family history of nails that curl, and they've had to have terrible surgeries that didn't go very well. This is back in the olden days. So this lady's trying to prevent it, and it worked really well. You know, it really helped. I've done maybe three of these braces, you know, once a month for 3 months, and the nails basically straight again, and no pain, no troubles. So but some people need more than that. You mentioned before surgery, so
Yeah.
tell us a bit about that. Is that a procedure that we do often in our clinic?
Yeah, we do them quite often, and we do them, like, the majority of cases that come through are kids, actually.
Lots of kids.
Lots of kids, yeah. Fairly active and probably, running around, and I don't know, yeah. So, but in terms of the process for nail surgery, so it doesn't sound as scary as it sounds.
It's not
No,
as scary
it
as it sounds.
sounds,
Does
yeah.
that make sense? Yeah.
Sorry. So basically, we would numb the toe with 2 needles with local anesthetic. So once that's numb, we then would use certain tools to remove that edge out. And then we apply a chemical called phenol to it to basically stop the nail from going back. Yeah. So.
And that's done as a permanent procedure, isn't it? So it's,
Yeah.
you know, can solve it. And for certain nails that look like this, that's what we'll have to do, is a procedure to remove the part that's misbehaving and curling under. And we've done that. I know all of us have done that many times for patients like this. So we've just spent 6.5 minutes talking about how we would fix that nail. So if someone at home has a nail like that, it all depends exactly what your situation is as to what treatment option we'd use, but we hope you have the idea now that we can definitely help with a nail like that, depending on your personal circumstances and what you need, and we'd love to. So yeah, if you're suffering with something like this, please give us a call or jump online and book in to see us. Okay, that's good. That's enough information on curly toenails.
Yeah.
Thank you for watching, everyone.
Thanks, guys.
Bye.
See ya.